So good.
Good morning,
Let
sir.
us start. Hello, everyone. Welcome. Okay. So we have in the last class we have finished up to 161. I think today we will start with 162. Is it not?
Yes, sir.
162. Okay. So we have told that there are two difficulties side by side. What in homeopathy we are doing? We are actually matching the symptom with the symptom of disease with the symptom of medicine. If either of these, this is, uh, suppose this is patient symptoms, है ना? And this is symptoms of medicine. These symptoms of patient and symptoms of medicine. What we are doing, we are getting this knowledge, we are getting this knowledge. Okay. And the third business is applying. Third business is applying. First business was getting this knowledge. Second business was getting this knowledge. And third business was, remember, 71. Is it not?
Yes, sir. Hmm.
Okay. So before we are going to proper application of medicine, now suppose this, what is this? What is this? This is application, no?
Hmm.
Knowledge of medicine, knowledge of disease, and this application. If either of this is deficient, you are handicapped. Okay, you are not having proper symptoms of disease, then this is falling under one-sided disease and you cannot apply your knowledge of medicine. Okay, or you are getting this but you are not getting this. Okay, this is knowledge of medicine is deficient. This knowledge of medicine can be deficient in two senses. One, the number of medicines is proven are very less that it cannot cover the symptoms of natural diseases. Okay, that was the case during the time of Hahnemann. But now there are more than, I think, 4,000 medicines available at our disposal, at the disposal of our fingertips. Okay, more than 4,000 medicines are there. So what kind of deficiency we are facing now? The deficiency we are facing, the lack of knowledge of all the substance, and that is falling under human limitations. Okay, so people are using repertory, but that has to its own limitations. Repertorizing a case with the computer, feeding the symptom, fetching the remedy is not the ideal case. Okay, that we will discuss at some time, that what kind of practice it is, feeding the symptoms and fetching the remedy. But to the human limitation I'm talking about is your own knowledge of all the medicinal substance and their all the symptoms. Okay, so this is one of the limitation we can face in our daily practice as of now. Clear? Now, again, you must have heard that if you are getting a symptom from the patient and not getting the similar symptom in your medicine, what that symptom is? That symptom is useless. Okay? The desire for, you will get patient desire for ghol, a peculiar Indian type of that या desire for biryani के साथ जो मिलता है घोल. Okay, that has some rubric, some kind of means similar rubric in your repertory, but not exactly that. Okay, if a patient is telling that desire for lychee, you are not getting this in your repertory. If you are your patient is telling that desire for some peculiar thing, okay, some peculiar fruit, you are not going to get this in your repertory, even in the modern repertories. Okay, this is the symptom but not present in the this available, not available here, not available in the medicines, not available in the repertory, so that symptom is useless. Okay, so what we are doing in homeopathy, we are knowledge of disease, knowledge of medicine, and applying this. Either of this deficient, you will be not able to do your work properly. So 162 onward, Hahnemann is talking about the deficient knowledge of medicine. When the number of medicines are moderate number of medicines. This was during the time of Feynman, but nowadays what difficulty, that difficulty have been solved. But what kind of difficulty we are facing? We are facing the difficulties of not knowing those medicines and their symptoms. Okay, so after this have been completed, Hahnemann is talking about from 172 onward. He's talking about deficient number of symptoms. Okay, that is one-sided disease. And after that finished, Hahnemann started with local diseases. Okay, after what kind of local disease is? Local disease is a kind of one-sided disease. Okay, after finishing that, Hahnemann is talking about topical applications, external application. Okay, after finishing that, there are 2-3 aphorisms on chronic diseases. Okay, after finishing that, Hahnemann enters in mental diseases. After finishing that, the mental diseases finished. What kind of mental disease is? The mental disease, what kind of disease it is? It is again a one-sided disease. Okay, see the chain. It is very easy to read from here onward up to intermittent disease. Okay, intermittent diseases finished at 244. Okay, intermittent diseases finished at 244. From here onward, just follow the chain. 162, Hahnemann has started with the difficulties we are facing. Okay, the moderate number of medicine or moderate number of symptom known. After this, the one-sided disease, and again this one-sided disease have been characterized in the internal one-sided diseases and external one-sided diseases. Now, internal one-sided diseases again have been characterized to mental and physical. Physical has been dealt first. Okay, then the external one-sided diseases, then mental one-sided diseases. Following the chain, after that, the special talk on intermittent diseases. Okay, more importantly to the intermittent fevers. Okay, after 245 onwards, repetitions in between these. Okay, what we are dealing with? We are dealing with knowledge of disease, compounding with the application of medicines, repetition. In between these, there are so many knowledge given regarding how to apply, what to give, in which potency to give. So many scattered knowledge are there. After 245, Hahnemann starts with proper application of and repetition, and question of doses will come after that. Okay, are you able to follow the chain? Okay, the whole organon is in this chain only. If you can follow this chain, it will be much easier to grasp the understanding of organon of medicine. Okay, clear? So from here onward, we will move smoothly to 244. Okay, from 245 onward, we will touch the philosophies also. Okay, regarding repetition, what is Kent is saying, what Stuart Close is saying, and what other chapters are important in Stuart Close or in Kent. Okay, clear? So
Yes, sir.
162, read it.
Sometimes happens owing to the moderate number of medicine, yet known with respect of their true, pure action, that but a portion of the symptoms of the disease under treatment are to be met with in the list of symptoms of the most appropriate medicine. Consequently, the imperfect medicinal morbific agent must be employed for lack of a more perfect one.
Underline this.
Yes, sir.
Okay, imperfect medicinal morbific agent must be employed for the lack of more perfect one. Okay, what was the actual difficulty? There was less number of symptoms, less number of medicines were proven at that time. Okay, but what kind of difficulty we may face? We have less number of symptoms known to the those medicines. Okay, okay. So
Yes, sir.
what is the problem here? the problem here is that we are uh, selecting an imperfect one, where the medicines from boric will come, medicines of small medicines of boric, when we are prescribing them, when we are not getting any symptoms which is calling for more bigger medicines. Okay, so these small medicines, this is not uh, actual simillimum, but next to simillimum, you can say, or a sort of imperfect selection in the absence of perfect one. Okay, underline this 162 last line. Imperfect medicinal morbific agent must be employed for the lack of the more perfect one. Okay, now 163.
In this case, we cannot indeed expect for this medicine a complete, untroubled cure. For
Okay,
during
why it is untroubled have been mentioned again, because there was a mention of homeopathic aggravation previously. Okay,
Hmm,
homeopathic
hmm,
aggravation previously there was mention. 155, go to 155. You say, you see, uh, I say without any considerable disturbance.
yes, sir.
Okay,
Hmm,
those difficulties may be faced in sort of homeopathic aggravation, but that homeopathic aggravation were easily covered by the vital force. Now, so here actual trouble can be here. Okay, and this is actually the daily practice. We are most of the case, means 40 to 60, 40 to 50% of cases, you will see that the cure is in zigzag fashion. Okay, the cure is in zigzag fashion in our practice. Almost this is the direction. This is cure, this is disease. Okay, this should be, if you were able to apply the simillimum, this should be your direction. Okay,
hmm.
is it not? If you are able to choose the simillimum, this should be your direction. But what is happening in our daily practice mostly is zigzag. Okay, थोड़ा सा ये सिम्टम दिया, फिर आया, फिर दूसरा सिम्टम दिया, फिर आया, फिर दूसरा सिम्टम दिया, और फिर और मेडिसिन दिया. This is what we are calling, this is following the relations of complementary, cognate medicines, complementary medicine, whatever you say. Okay, mostly in our daily practice, cure is in this zigzag fashion. Okay, and why this is happening? Because of we are unable to search this path, simillimum. Okay, so zigzag. So this is also a way of cure. Now, next.
For during its use, some symptoms appear which were not previously observable in the disease. Accessory symptoms of the not perfectly appropriate remedy.
Underline this. Underline this. What is accessory symptoms of medicine? This is accessory symptoms. Accessory symptoms of disease is different thing. But accessory symptoms of medicine, this is some symptoms appear which were not previously observable in disease. What is Kent's test?
Sir, you are not audible. Okay, okay.
Am I audible?
Yes, sir.
There was a disruption. What I was telling?
Sir, you are saying that Kent का कुछ बता रहे थे.
Okay. Okay. Kent's, what is Kent's 10th observation?
Kent कितना सर
10th
Kent का?
observation. 10th observation.
Coming of new symptoms.
Okay. coming of new symptoms. Okay, what is this new symptom is? Kent is saying this new symptom. Acha, whenever you are getting a new symptoms during in your prescribing, okay, whenever you are getting new symptoms during your prescribing, you have to search it first with the patient that if it was present before. Okay, if it was present before, then it is actually not the new symptoms but coming of old symptom, which is a good sign. Okay, then you have to see that whether these symptoms corresponds to the disease the patient is suffering from. So this is the progress of disease. Okay, these new symptoms indicate the progress of disease. Okay, that go to aphorism number uh, I think 256. Aphorism number 256.
Shall I read, sir?
Yes.
Okay. On the other hand, if the patient mention the occurrence of some fresh accident and symptoms of inappropriate dash
Inappropriate.
sign,
Where inappropriate is written?
the symptoms of importance.
Yes.
Uh-huh.
चबा चबा के पढ़ो, आहिस्ते आहिस्ते पढ़ो, आराम से. ऑर्गेनन पढ़ने का ये तरीका है. I have told you before that read Organon slowly with punctuations, and it will you will grasp the knowledge.
Dash signs that the medicine chosen has not been strictly homeopathic.
Okay, this bracket thing can be applied there. Why there were new symptoms? Why there were new symptoms? What we
Because
are
the medicine
reading there, 163. Why there were new symptoms? Because the medicine chosen was imperfectly homeopathic. Is it not?
yes sir. Yes sir.
Okay. So what is the Kent's 10th observation? Is new symptoms. Why new symptoms are coming? Again, there also medicine chooses in not homeopathic. So do you think that Kent have made these observation on his own? No, he have taken these observation from Organon only. Okay, and compiled it. What we have discussed in the last class, that Herring's contribution is compilation of that law. That law was present before. Kent's contribution is compilation of these observations. That these observations was present before in Organon, but he made it easy for us to grasp. Okay, this is his contribution, but not the original contribution. Okay, so this science that medicine chosen has not been strictly homeopathic. Number one. Next.
Even though good he should good naturedly assure us that he feels better. We must not believe this assurance, but regard his state as aggravated as it will soon be perfectly apparent it is.
Okay, so aggravated in two senses. Either it is the progress of disease, okay, or it is the accessory symptoms of medicine. Getting it?
Yes, sir.
Aggravated in two senses. Either this can be a progress of disease, okay, or it can be the accessory symptoms of medicine you have given. Okay, clear?
Sir,
Now, let me give you a case of prostate cancer. Do you know that where the prostate cancer usually metastasis of prostate cancer usually go to where? From prostate cancer, the cells are metastasis to which organ? Usually, most common site of metastasis for prostate cancer. If you know that because of that connection of arteries with the
sir, your voice is breaking.
one of the case I have dealt few.
सर
That was a hopeless case, Phatak repertory.
सर आपका वॉइस ब्रेक हो रहा था.
Okay, अभी आ रहा है, आवाज आ रही है?
सर अभी सही आ रहा है.
Okay, Phatak repertory, prostate. The one of the hopeless case of prostate cancer. Actually, it was a case of one of my student's father. Okay, see, prostate gland cancer. Only single medicine is given, Crotalus horridus. In the bladder cancer also, you can think of Crotalus horridus. It is very useful medicines. In these type of hopeless cases, organic level or means pathology have been so advanced, you can depend upon this repertory. Okay, Phatak repertory. And you can prescribe on clinical symptom, because the vitality is not so strong that it is going to give you the individual characteristic symptoms. Okay, but sometime it may happen that you are getting those characters PQRS, and you can prescribe. But in that case, also this is a side topic. For that, I prescribe Crotalus horridus in 0/1 with patient was telling to me that he's okay. Okay, he's fine. Symptoms are improving, this and that. But there is a backache. Okay, ডাক্তার বাবু আমার পিঠে ব্যথা হচ্ছে, হ্যাঁ কোমরে ব্যথা হচ্ছে. He is assuring me this thing that I am okay, I am okay, I am okay. Okay, I am feeling much better, much fine. But that what was that? That was good naturedly assuring us that he feels better. 256, underline that. Okay, but you know, by this fresh occurrence of symptom, that the prostate cancer has been gone or was there, metastasis was there in the spinal column. Okay, that is why this fresh symptom of backache has been coming. Okay, getting it? Fresh symptom maybe the indicate the progress of disease. Okay, in the 6th edition bracket you will see, as it not frequently the cases of thiacical patient with lung abscess. Okay, that is also difficult to cure. And you will get progress symptoms indicating the progress of disease. Okay, symptoms indicating the progress of disease. Okay, the CRF patient, chronic renal failure patient, is better on your medicine, but your medicine is unable to cure it, and by the occurrence of edema of the leg, okay, you know that this is something indicating the progress of disease. All of a sudden one day you encountered that डॉक्टर साहब ये delirium में चले जा रहे हैं, कुछ का कुछ बोल रहे हैं. You know that urea is above, that it is causing encephalopathy. Okay, by the fresh occurrence of symptoms, in spite of that, patient is assuring you that he is better, but by these fresh occurrence of symptoms, you know that either it is progress of disease. If this is not progress of disease, you search your medicine you have prescribed, you will get that symptom in your medicine, and that is the accessory symptom of medicine which have been called for. Okay, because of your imperfect selection. And why imperfect selection was there? Two reasons: because you don't know, that you have less knowledge of medicine, or you are unable to get the PQRS. Okay, clear?
Yes sir.
Okay, so these two difficulties have been dealt with. Number one, we are dealing with the lack of knowledge of medicine. Lack of knowledge of medicines. At Hahnemann's time, it was moderate number of medicine. At our time, it is actually the lack of knowledge, and this is our human limitation. Okay, accessory symptoms of medicine. Next,
163 sir.
163. second sentence.
These dose by no means prevent a considerable part of the disease from being eradicated by this medicine, thereby establishing a fair commencement of the cure. But still this does not take place without those accessory symptoms, which are, however, always moderate when the dose of the medicine is sufficiently minute.
Okay. So when you are giving a imperfectly similar medicine, when you are giving a imperfectly partial similimum, when you are giving partial similimum, expect this accessory symptom of medicine to be coming in line. Okay, these accessory symptoms of medicine will come. Expect this. Clear? But 164. Read 164.
The small number of homeopathic symptoms present in the best selected medicine is no obstacle to the cure in cases where these few medicinal symptoms are chiefly of an uncommon kind and such as are peculiar distinctive characteristics of the disease. The cure takes place under such circumstances without any particular disturbances.
Underline this. In cases where uncommon kind such as peculiar distinctive characteristics of disease is present. Okay, this may be a case where your medicine, which is you were thinking that this is partial similimum, your medicine content that particular symptom. Okay, maybe your medicine have been not been well proven, and other symptoms are also present in that symptom, but that medicine, but this is not in your knowledge. Okay, but that particular peculiar symptoms was there in that medicine which cure. Okay, again let me tell you that what I have told, this is the symptoms of disease, P, symptoms of patient, this is symptoms of medicine. Okay, what we are doing, we are trying to match this. This is application, this is knowledge of disease, this is knowledge of medicine, and this application. If either of you will not be able to apply this. Okay, if either is deficient, so knowledge of medicine is deficient, you are not able to apply knowledge of this is the first obstacle, that a small number of medicines or a small number of medicines known to you, knowledge of medicine is deficient. And this is number two obstacle was knowledge of disease, one-sided disease, symptoms are not there. Okay, symptoms are not there, and this 164 can happen in one-sided disease also. Okay, go to 177.
In
Of
order to
178.
it will no doubt sometimes happen that these medicines, selected in strict observation of the homeopathic law, furnishes the similar artificial disease suited for the annihilation of the malady present. And this is much more likely to happen when these few morbid symptoms are very striking, decided, uncommon, and peculiar distinctive, that is characteristic.
Okay, underline this. Okay, this can happen. What we are telling, that our knowledge of medicine is limited, so here we have to go for partial similimum. But it can happen that one symptom present here is exactly peculiar, PQRS, and can cure the disease. Okay, can cure the disease, 164. And 168, knowledge of disease is deficient, but that symptom which were present was actually characteristics of that disease and have been matched by our medicine. Okay, okay, 178, this can happen. But most of the time you are going with, if you are going with partial similimum, if you are going with first case, that knowledge of medicine is lacking, you have to go with partial similimum. If the knowledge of disease is lacking, one-sided disease, You have to go with the same thing. Whatever symptoms are available, apply this. Okay? Clear? Cure in the zigzag fashion. So 164 completed. 165. Go to 165.
If, however, among the symptoms of the remedy selected, there be none that accurately resembles the distinctive, characteristic, peculiar, uncommon symptoms of the case of disease, and if the remedy correspond to the disease only in the general, vaguely described, indefinite states like nausea, debility, headache, and so forth, and if there be among the known medicines none more homeopathically appropriate, in that cases the physician cannot promise himself any immediate favorable result from the employment of this unhomeopathic medicine.
Okay? Cannot promise any immediate, underline this. Mostly, if that symptom you have chosen is not peculiar distinguish. Okay? That is sometimes happens. I have narrated a case of one of the stalwart in Bengal that he cured that uh, cancer of the head of the humerus. No, remember that? How it
Yes,
was
sir.
possible? There was no such distinguished symptom was present. Okay, but only on that he prescribed teucrium in 12 potency, and it cured that. Okay, cancer of the head of humerus was cured. What has happened here? Same thing, 178. Okay, that was peculiar, distinctive, characteristic symptom which has been matched with the. So this sometimes happens. Okay, that you have given thinking that this is partial similimum, but there is an X factor, that is PQRS, which made your medicine similimum, and the cure occurs. Okay, so that is why in Bengal homeopathy, in Calcutta School of Homeopathy, we are more concerned with PQRS, peculiar, distinguished, characteristic symptoms, and we have proven that it was the method of Hahnemann also, it was the method of Bonninghausen also. Okay, and it was the method of Allen, and it has been coming from that lineage only. Okay, these PQRS, why this is important. In Calcutta School of Homeopathy, we are more focusing on PQRS. We have discussed somewhat the keynotes, how keynote prescribing is used. Okay, so that is regarding PQRS. But if the symptom is not peculiar distinguished characteristics like nausea, debility, headache, and so forth, what are these symptoms? These are nothing but Hahnemannian general. Okay, these are nothing but Hahnemannian general. 153 second part. 153 second part. The more general and undefined symptoms.
The
What
more
is Kent's
general,
general? What is Kent's general? Kent's general is totally different thing. Okay, evaluation of symptoms according to Kent have led us to a totally different arena. Okay, that is totally different. But what is Hahnemannian general? The more general and undefined symptoms, loss of appetite. Hello, read it.
loss of appetite, headache, debility, restless sleep, discomfort, and so forth, demand but little attention when of that vague and indefinite character, if they cannot be more accurately described, as symptoms of such a general nature are observed in almost every disease and from almost every drug.
Okay, almost underline this. Why these are not that important? Because it is present in almost every disease. Loss of appetite, nausea, debility, these are the features of every disease, and almost all the medicines are able to produce these symptoms. Okay, like just fever, ডাক্তার বাবু ফিভার হয়েছে, আর কিছু নেই, ফিভার হয়েছে, আমার জ্বর হচ্ছে, বাস। তো জ্বর বললে আমরা ট্রিটমেন্ট করতে পারবো না। We are unable to prescribe medicine just on fever. If you open Kent's repertory, you will get that there are hundreds of medicine for fever. But if this fever is classified with 7 a.m. aggravation, classified with midnight aggravation, classified যখন জ্বর হয়, when there is fever, I am feeling thirstless. Okay, this is modified and classified. Then these generals are becoming more important. Okay, are becoming, whatever I am telling in Bengali, I translate it into English. Okay, so please don't mind that. Sometime it occurs that I am speaking in Bengali or speaking in English, but the moment I speak that language, I try to translate in English. Okay, so if it is fever, unclassified fever, that just fever, I am suffering from fever. Okay, so this is what? This is a general symptom. This is a general symptom. You cannot prescribe your medicine on this. But if there are lacking of other symptoms, you have to prescribe on this. If there is lacking of other symptoms, you have to choose only this symptom. That is imperfectly selected medicine. Okay. Okay. So these
Yes.
describe indefinite states, nausea, debility, and not classified. Headache. There are so many medicines with headache. So many medicines with just only headache. But headache, occipital region, ameliorated by profuse urination. Which medicine you are coming to? Gelsemium. Headache, occipital region, ameliorated by profuse urination. The medicine is narrowed down to single medicine, gelsemium. Okay, then this is peculiar characteristics, well-defined symptoms. Okay, so but if you are not getting this, or if you are not aware of that medicine, okay, here the gadgets can help you. Okay, here the repertories, the homeopathic repertories may help you. Okay, if you are not, if even if you are not getting that, then you have to select whatever available. Okay, so next
166 sir.
165 पढ़ लिए पूरा.
हाँ sir.
Okay, next 166.
Such a case is, however, very rare owing to the increased number of medicines whose pure effects are now known and the bad effects resulting from it, when they do occur, are diminished whenever a subsequent medicine of more accurately resembles can be selected.
What is this? This is from here on what? Conduction of cure with the less number of medicine. Okay, this is conduction of cure. How to conduct after another, you are giving medicine. Okay, such a case, which cases are very rare? Those where you are not getting any symptoms, any PQRS, you are not getting any well-defined symptoms. Those cases are now means you are not getting the resemblance of that symptom in your materia medica. Okay, you are not, these cases are now very less, because that Hahnemann is telling of his period, but now to our period it is also true that these cases are very less, where you are not able to search the symptom of disease in the your materia medica and your repertory. But if this happens, this is the way to cure. First give your medicine, whatever whatever available, give that. Here the boric small medicine will come into action, where you are giving medicine, small medicine, after that. Okay, and here the relationship chart will be very much helpful. Three things you can, three books you can take help of that. One is Gibson-Miller's relationship. It is available to the Boric Materia Medica as an appendix, to the Kent's repertory as an appendix, and it is available as a booklet also. Okay, Gibson-Miller's relationship chart. Next, a bit difficult to use, that Bonnie Hussein's last chapter, BTPB, Therapeutic Pocketbook, last chapter. It is a bit difficult to use, but it is very useful on relationship. Okay, and last is, I will recommend this for clinical purpose, for all our clinical purpose, this book. Okay, This encyclopedia, I have a Xerox copy of it because it is not easily available. If it is available in PDF, I will be sharing it in the group. Encyclopedia of Homeopathic Remedy by Abdul Rahman. Okay, this is actually the treasure of uh, relationship. Okay, each and every medicine have been each and a relationship of each and every medicine have been given with proper reference. Okay, like if they are saying that kali iode iode is complementary to thyroidinum. Okay, if they are saying that kali iode is complementary to thyroidinum, they are giving the reference. Okay, those books which are not carrying a proper reference to the literature should not be believed with. Okay, now many materia medica, modern days materia medica, modern days organon of medicines, and there are teachers of materia medica and teachers of organon of medicine who are just theorizing the things, hyper philosophical things, and theorizing it without any proper foundation and basis. Those books should be avoided. Okay, if this book was he is talking about relationship. If he has not given this proper reference from where he is talking about, I won't be able to recommend this book. See, this whole reference chart have been given at the end, so it is very useful. Like 143, who is telling this? Principles of homeotoxicology, 1981, Baichi. Okay, so there are lots of reputed author and lots of reputed books are there in this reference. Okay, so he have collected all the references in a single volume. Okay, so this is very useful book. So most of the time I use Gibson Miller's chart for complementary relationship and follows well relationship. And after that, I use this Abdur Rahman's Encyclopedia of Remedy Relationship in Homeopathy. If I have any PDF of that, I will share it. Okay, in the group. So relationship makes important after you have prescribed medicine. After that, which medicine to prescribe? Underline this. More accurate resemblance can be selected. This will help you. Underline this. I remember a case of Rustox. Okay, I prescribed Rustox on the basis of relationship. Okay, that lady was having a breast cancer. Okay, that lady have died long before. It was my initial days of practice, and one of the patient asked me to visit her grandmother because she was unable to go to doctor, and doctor has given that she was 80 years old at that time and suffering from breast cancer, and that breast, due to that breast cancer, there was lymphangitis, lymph blockage of lymph channels, and there was lymphedema of the right hand. Whole of the right hand was swollen. This was a lymphedema because of the obstruction of lymph channel due to that breast cancer. Okay, so the lady, after proper case taking, I found that lady to be of calcarea carb lady. Okay, calcarea carb. But at that period of time, I cannot prescribe this kind of deep acting medicine. To that, it may aggravate, or at that period there was a phobia of the first reaction to me, that Kent's first reaction may occur, advanced pathology, this and that. So I prescribe that calcarea's acute are two medicines, belladonna and Rustox. Okay, we know only in proper in uh, uh, this is famous relation is calcarea and belladonna, but like belladonna, Rustox is also an acute for calcarea patients. Okay, so there was lots of pain there, and there were some modalities of Rustox I found, and there was some other I didn't remember. I actually don't remember, but I prescribed Rustox 30 in fractional doses. Okay, to be taken TDS, and that lymphedema gone within 1 or 2 weeks. Okay, that lymphedema gone. So that boosted my practice at that time, because the patient, what I have given, I have just given a palliative acute remedy to that lady. I cannot promise to cure this breast cancer, but on the basis of this relationship, I was coming to Rustox. Okay, this will happen that if you have a proper understanding and proper knowledge of relationship of medicine, you will be able to prescribe. Okay, so like calcaria, I diagnosed the case with calcaria and given Rustox. Okay, if the belladonna was coming, I would have given belladonna, but at that time Rustox was coming. Okay, same thing. Uh, so when to prescribe, this is again a side topic we have deviated to. When to give Rustox, when there is symptoms, means more in calcaria, you will get that symptoms aggravated by working in clay. Okay, in Allen's keynote, you will get uremic symptoms by working in clay. Okay, this is actually, and uh, uh, if you want to give the acute medicine for that calcaria will, you will give calcaria at the later stage. You can start with Rustox. Okay, if the glandular affections of calcaria are there, you can give belladonna. If there is high fever, okay, high fever, you can go for belladonna. But there is, if there is malaise, which with a sort of chilliness, just malaise and joint pains, you can go to Rustox, and ultimately these Rustox and belladonna will converge your patient to calcaria. Okay, so these kind of relationship throughout your practice you will discover and you will remember. Okay, now 166, these 167.
Thus, if there occur during the use of this imperfectly homeopathic remedy first employed accessory symptoms of some moment, then in the case of acute disease, we do not allow this first dose to exhaust its action, nor leave the patient to the full duration of the action of the remedy, but we investigate afresh the morbid state in its now altered condition and add the remainder of the original symptoms to those newly developed in tracking a new picture of the disease.
In tracing a new picture of disease. Okay, if there occur during the use of this imperfectly homeopathic or first employed accessory symptom of medicine, cases of acute disease, underline this. I have a call, let me receive it. In acute cases, what we were doing there in 91, in 92, conjoint malady, 92.
Hmm.
Okay,
Yes, sir.
what we were doing in acute cases, we are giving medicines which demand our symptom. If accessory symptoms are two in acute cases, usually this is the mode of conducting your medicine. I have seen a physician in acute cases giving one after one medicine, like he starts with all the cases of sulfur. This is his way of practice. He have developed that he starts with sulfur, and again, which is sulfur to every acute case. He is giving sulfur. If the fever is high, sulfur 30, then indicated medicine, then that complementary of that medicine. Okay, so in acute cases, a series of medicine he have learned, he have practiced. I don't advise that kind of practice unless you are the master of your trade, but he is a older physician and he's practicing in that fashion. So he's following what? He's following this. Okay. but without any further case taking. He is giving his medicine on assumption only. Start with sulfur, give the indicated medicine, give the complementary of this. Okay. So in acute cases, what Hahnemann is advising in such cases, we are not going to let the first dose exhaust its action. Okay. Okay. Nor we are allowing the medicine, both are same. We are allowing the medicine to act full duration, but we are taking freshly, adding those accessory symptoms to the case present and then selecting a new medicine. Okay, getting it?
सर फिर से एक बार बोलिए ना.
क्या कर रहे हैं? What we are doing actually, that if we have prescribed a medicine to a patient, and actually his symptom was 1 2 3 4 5, ठीक है, we have prescribed our medicine, 1 2 4, like 3 and 5 gone, plus some symptoms of medicines are added, A, B. Okay, what we will do now, we will take this whole picture. Okay, and now we'll prescribe our medicine. Clear?
तब तो ये पहला वाला दवाई दिया हुआ तो पार्शियली सिमिलर ना हुआ.
हाँ, पार्शियली सिमिलर हुआ.
अच्छा, तो ये
Okay.
पार्शियली सिमिलर के लिए होगा ना सर?
हाँ, ये पार्शियली सिमिलर के लिए होगा.
अच्छा.
Got it?
Yes sir.
Okay. So this is the conduction of cure in a zigzag fashion. Now go to 168.
We shall then be able much more readily to discover among the known medicines an analog to the morbid state before us, a single dose of which, if it do not entirely destroy the disease, will advance it considerably on the way to be cured. And thus we go on. If even this medicine be not quite sufficient to effect the restoration of health, examining again and again the morbid state and still remains, and selecting a homeopathic medicine as suitable as possible for it, until our object, namely putting the patient in the possession of perfect health, is accomplished.
Our object, underline this, putting the patient, what is our object? This happen be an MCQ question in your examination, that what is the object according to 168? Putting the patient in possession of perfect health is accomplished. Underline that. Okay, so this is, we are doing again and again like that. There were symptoms 1 2 3 4 5. We have given medicine, and what that medicine have done, 1 3 4 5, 5 number symptom were removed, but A was added. Okay, now again we will give medicine, and what happened, 1 2 B, new symptoms added. Okay, of medicine, but disease symptoms is getting less and less. Again, what we will do, we are again giving medicine, now 2 is present, and accessory symptom C is present. Okay, again we will give medicine, only D is present, which is accessory symptom of medicine. All symptoms have gone. Now wait and you will get a cure. Okay, got it?
Yes sir.
Original 1 2 3 4 5 symptoms were given there. We applied medicine and got 1 2 3 4 plus A. Now again, what we are doing, we are taking this whole picture. Okay, this whole picture 167. Now this, what that have done, 1 2 and B. Okay, there may be A again. Okay, so again we are giving medicine 2 plus C. Okay, again we have given medicine and only accessory symptom of medicine. Then we reached cure. Clear?
Hmm.
Is it clear?
Yes, sir.
Okay. Okay.
Sir, can I ask something?
Yes, yes, you can ask. Yes, you can
Sir,
ask.
actually, my question was, sir, वो जो accessory symptoms आप मिला के next remedy देते हो, it is a kind of pattern of zigzag treatment only, no, sir?
Yes, yes.
Sir, अगर हम लोग like if we take a case initially and if we get almost all symptoms except few symptoms in the remedy, okay,
Mm-hmm.
and like when we prescribe, okay,
Mm-hmm.
and the patient is quite happy with the treatment,
Mm-hmm.
the new symptoms are also not coming, but then
Mm-hmm.
if the case is getting cured and after some time if it stops, again the
Mm-hmm.
older symptom starts coming, then we need not go for the zigzag treatment and all, no, sir. Only the
Symptom.
potency can be changed and then we can proceed with the treatment, right?
Which older symptom is coming?
Older symptom like like the case which I was treating is of lichen planus. She is a
Mm-hmm.
lady of 53 years old, a known case of
Mm-hmm.
diabetes, known case of hyperthyroidism,
Mm-hmm.
wherein she came to me with the to get treated for lichen planus. Okay,
Mm-hmm.
I started with the treatment. I gave her sulfur, taking the case. I found it more close to sulfur because there was itching and burning present. And
Mm-hmm.
initially, the patient was not opening up that much. But then, looking at her diabetic pattern, like, it wasn't very high, and more so, it was looking like psoric because no much, rise and fall was not there, very steady, and it was under control also with the allopathic
Mm-hmm.
treatment.
Mm-hmm.
And the scars were also like only superficial one. I did not find any very deep scarring and all, so I had thought it is in a psoric phase, and I had given her sulfur. She responded very well, and in the follow up she opened up very well. Like initially she wasn't talking much, but then she started speaking. She told, I myself feel liberated and my mind is open now. I'm asking whatever I desire for. She was very quite happy. But then after 2 months, day before yesterday, when she came to me again, older symptoms like the scars coming and the itching and the eruptions were seen on the skin.
Repeat the medicine. That is the second prescription repetition of the older one.
हाँ सर, सर ऐसा होगा तो we need not look for, like for example she had told me in the last thing, in her last follow up,
Mm-hmm.
she had not complained about itching in the eyes and watering of eyes.
Mm-hmm.
Okay, but then she in the follow up she told she had previously those, now it has come down. Without she telling me about the symptom, it has covered, the drug has covered even that symptom. So for
Okay.
this, what can we say, sir? The patient had not addressed the symptom, but then the
Mm-hmm.
drug is, when prescribed, covered
That
the
is clinical
symptoms.
proving. That is clinical proving you are getting.
Okay, okay, sir.
Okay.
So, but then
That
it
is
is
a
not possible in every case, no?
it is not possible. Which is not possible in every case.
Like the patient is not told about the symptom, but the drug is covered it.
Huh? This is possible in every case. This is possible. You will feel surprised to know that patient is telling that डॉक्टर साहब इसके लिए भी दवा दिए थे ये भी ठीक हो गया. This has this will happen to you.
Okay,
Okay.
sir. Okay, so because I was wondering if the lichen planus is a very tough case to handle, and with sulfur
Hmm.
she responded very well. But
Okay.
now I'm confused what to give her in few like follow-ups.
Repeat the medicine. Repeat the medicine. Whatever medicine you have given, you have to repeat it.
Yes. Okay. सर
Okay.
वो यूरसा वो वाला मेडिसिन रिपीट नहीं, मतलब if we change to that, will that help to her?
Which medicine?
यूरसा बोल के एक मेडिसिन है सर.
Ursa. I don't. I'm not aware of that.
So I'll
Ubiursa.
forward you that.
Ubiursa. Ubiursa.
Yes, sir. Yes, sir.
Okay. Okay. That's depend upon the case.
Because itching was too much, sir. She told कि itching बहुत हो रहा है.
Okay. That depend upon the case. what you should do.
सर बिकॉज अभी
Whichever
आपने बताया ना कि 1+2 and A then it comes C and all no sir, लेकिन ऐसा C वगैरह कुछ आ ही नहीं रहा है केसेस में, so it's only
ठीक,
like 1 2 3 4, so that
हाँ
time I'm asking.
हाँ, तो the symptoms of disease, no, only the symptoms
Yeah,
of disease are there.
yes sir.
So this is Kent's second prescription. This is Kent's second prescription. What is the repetition of the medicine? Whatever medicine you have given, you have to repeat it only.
Okay,
Okay.
okay sir. Okay sir, thank you sir, thank you.
Or plus, you can search for a complementary of that medicine. Okay. You can
Okay
search
sir.
for a complementary. What are the complementary of sulfur? It may be sorinum, it may be tuberculinum. Okay. So
Okay
this
okay sir.
sorinum and tuberculinum are more deep acting medicine. Okay. So the lady will shift to either to tuberculinum or to sorinum. You will get a change of thermal reaction. Okay. Previously, the lady may be of hot thermal reaction. Now she is more chilly. So go to this sorinum, that will indicate
Okay.
towards sorinum. If the itching is aggravated at night, okay, that will more towards sorinum. Okay, sorinum
Okay.
has a syphilitic prominence with sora. Okay,
हाँ sir.
so that will
Okay
go
sir.
to sorinum. If there is allergic manifestation, you are telling watering from the eyes, redness of eyes is there, you can think of
Yes.
tuberculinum. Okay, that
Okay sir.
sulfur, your prescription of sulfur was good. Okay, that
Yes
is
sir.
why
Yes.
you can think of, if sulfur is not working anymore, you can think on this line of complementary medicines of sulfur. Okay,
Okay sir. Okay sir. Okay, thank you.
so 169.
Okay. If on the first examination of a disease and the first selection of a medicine, we should find that the totality of the symptoms of the disease would not be effectually covered by the disease elements of a single medicine, dash, owing to the insufficient number of known medicines, dash closed. But that two medicines contend for the preference in point of appropriateness, one of which is more homeopathically suitable for one part and the other for another part of the symptoms of the disease. It is not advisable, after the employment of more suitable of the two medicine, to administer the other without fresh examination for the medicine that seem to be
Read the sixth edition also.
okay, sir. Without fresh examination and much less to give both together.
Wait here. Here comes symbiotic, I think that is synthetic prescription of medicines. Okay, open 272. Before that, tell me how often this has happened to you, that you are getting a mixed picture of two medicines.
Many times sir.
Often? Many times.
Many
Very
times
good.
sir.
Many times. What medicines you are getting? Tell me some examples.
Sir, like lycopodium and Rustoxka sir.
And
Phosphorus and Carboveg.
okay. So what you will give? Both together? No.
No sir.
One
No.
after another? No.
Yes,
Okay.
like it's like sir, what prominent symptom is there? Then which is more marked, I prescribe that.
After then, we have to go for the next. Okay.
Yes,
Even
sir.
after proper case taking only. But let me
Yes, sir.
tell you what has happened during Hahnemann. Hahnemann's
Hmm.
time. 272 footnote. 272 footnote.
Until
Now, footnote. 272 footnote. Some homeopathists have found
Acha, okay. Some homeopathists have made the experiment. This one, sir.
Yes.
Okay, sir. Some homeopathists have made the experiment in cases where they deemed one remedy homeopathically suitable for one operation of the symptoms of a case of disease, and same time and a second for the another portion of administering both remedies at the same time or almost at the same time. But I earnestly depreciate such a hazardous experiment, which can never be necessary, though it may sometimes seem to be of use.
Even to Hanneman, it seems to be of some use. Okay. Even to Hanneman, who have suggested this to Hanneman? Was this man who have suggested this to Hanneman? I have told you in some previous classes that AJD was the man who have uh, Dr. AJD was a veterinary surgeon who became disciple of Hahnemann and started practicing homeopathy. So he advised, Dr. AJD advised Hahnemann to this concept, introduce Hahnemann to this concept that at times it is a common happening in our clinical practice. At time you will get some portion of the case is being covered by one medicine and some portion of the case are being covered by one medicine. So what to do? Dr. HD advised that you can give these medicines together. Okay. So even to that, Hahnemann in 5th edition may sometimes seem to be of use. Underline this. Now, but the case is totally different in 6th edition. Here he is denouncing it mildly, telling that it may be of some use. Okay. Now in 273, 6th edition, you will see that in no case, read it.
In no case under treatment is it necessary and therefore not permissible to administer to a patient more than one single simple medicinal substance at one time. It
बस
is
यहाँ पे खत्म. Stop. The buck stop here. That in no case, no two medicines are advisable to give. Hahnemann have stopped this matter in the 6th edition totally. Okay. Now go to footnote to 272. Footnote to 272. 6th edition.
okay. Until the state in the
To 6th
future,
edition. 272 6th edition. You are reading 271. Now go to 272 6th edition.
two substances, this one, sir.
Yes.
Two substances opposite to each other united into neutral natrum, and the middle salt by chemical affinity is unchangeable portion in unchangeable proportions, as well as sulfated metals found in the earth and those produced by technical art in constant combining proportions of the sulfur and alkaline salts and earths. For instance, natrum sulf, calcarea sulf, as well
Underline this.
as
Underline this. You can add here to many compound of sulfur, many compound of natrum.
those ethers produced by distillation of alcohol and acids made together with phosphorus be considered as simple medicinal substances by the homeopathic physician and used for
Underline this.
patients.
Underline this. Simple medicinal substance by the homeopathic physician and used for patients. Okay. So stop here. What he is actually telling that if you are objecting that natrum sulf is a two medicine at a time, okay, that is not true because whenever natrum and sulfur is meeting, they are forming a compound. Okay, what is compound? In a fixed proportion. What is mixture? No fixed proportion. What is compound? They are reacting in a fixed proportion. Okay, and they are not easily separable in their parts, and we are using after proving that natrum sulf I have given to prover and recorded the symptom, and then only I am using it. Calcarea sulf, this is not two medicine, not sulfur, not calcarea. Okay, but it is calcarea sulf of its own entity. Okay, like a child is born out of two parents, but it is resembling those two parents, but the child has a personality of his own. Okay, so this calcarea sulf has a symptom of its own. Clear? From here emerges Kent's prescription, synthetic prescription. If you read Kent's lesser writing, there you will find an article on this synthetic prescription. Okay, this was revealed. I have read these articles before. I knew these things before, but sometimes some moments are required to uh, embed these things onto your mind. I was sitting in my OPD during my PG years. Okay, I was sitting. A house staff came with a case, and she told me that भैया natrum भी आ रहा है, sulfur भी आ रहा है, तो क्या देंगे? So that was just striking to me that I don't both give both. And I was like, how I can give two medicines? Well, you have a medicine which is consisting both natrum sulf. Okay, in Bengal, in colleges, in institutions, we practice a classical homeopathy in the true Kentian or Hahnemannian sense. It is a sin to even think of two medicines in our institutions in Bengal. Okay, so I told her that we are not giving natrum alada and sulfur alada. We are giving natrum sulf. Okay, this is, and then the whole synthetic prescription, sort of synthetic prescription revealed to me that, and after that period, I have used aurum sulf. Okay, in a patient, which was giving me a symptom of aurum and symptom of sulfur. Okay, I used aurum sulf to that patient. To this day, that patient, whenever he used to meet me, that Dr. Saab, aapne hame bacha liya. And the patient was that at the verge of suicide. So much depression was there. And physically, he was of sulfur. But mentally, he was giving symptoms of aurum. So what to give? I first prescribed aurum mate, and then thinking of this synthetic prescription, I prescribed aurum sulf. And later on, to my delight, I found in Clark's Materia Medica, you will get, if you read in Clark's Materia Medica, aurum sulf, you will get a line where he is telling aurum mentality in a sulfur patient. Like this, a line is there. Okay, so interesting, so fascinating these things are. Okay, so remember always, whenever you are getting some symptoms of one medicine and some symptoms of other medicine, try to search a compound medicine for that in your Materia Medica. If it is available, you are lucky. Okay, otherwise, other concept is whenever there is indications of 2-3 medicines. Okay, so a nosode will cover that. To try to search a nosode of that group. Like if you are getting indications of 3 or 4 polycrest, you can most probably go to carcinosin or other nosode or sarcode like thyroidinum. Okay, so if multiple polycrest are indicated, you can think of nosode which can cover them all. And one, there is other concept of some physicians, like something of arnica, something of sepia, something of pulsatilla will make aristolochia. Okay, something of arnica, something of sepia, something of pulsatilla will make aristolochia clematis. Okay, like these concepts are there in our Materia Medica. हम पढ़ते ही नहीं है. There are lots of things you can use in your daily practice. Okay, I prescribe astrolochia on the basis of this. Okay, with osteoarthritic nosode, you will get a lycopodium personality and modalities like Rustox. Okay, lycopodium personality, advanced osteoarthritis plus modalities of Rustox. So these are the cases, these are the things which can solve your case easily rather than thinking of more medicines, 2 or 3 medicines at a time. Think of which medicine can cover these all. Okay,
सर ये
now
लाइकोपोडियम और इसका क्या बताए सर आप? लाइकोपोडियम और रस्टॉक्स का अगर हो तो कौन सा देना चाहिए?
osteoarthritic nosode, OAN, osteoarthritic nosode.
ओके सर, उसका डोजेज
Okay,
होता है सर, उसका पोटेंसी होता है?
पोटेंसी होता है, एलएम पोटेंसी में भी अवेलेबल है यहाँ पे कोलकाता में, आपके वहां पता नहीं, आपके वहां पे ये मिल जाएगा, सेंटिसिमल में मिल जाएगा.
ओके सर, ओके सर.
ओके, ऑस्टियोआर्थराइटिक नोजोड, लाइकोपोडियम पर्सनालिटी, एडवांस्ड ऑस्टियोआर्थराइटिस प्लस रस्टॉक्स लाइक मोडालिटी. Okay, so we will stop here up to first part of 169. Anirban, কোনো কোশ্চেন আছে
Yes.
তোমার?
Sir,
Any question?
yes, sir. You told about the zigzag treatment, no? So there I want to just add a thing. मतलब पूछना चाहूंगा सर, सर ये zigzag treatment क्या ट्राइमास्मेटिक केसेस में ज्यादा होता है?
कौन से माइजमेटिक केसेस में?
ट्राइमास्मेटिक मतलब सोरासिफिलिस एंड साइकोसिस तीनों है जहाँ पे.
हाँ, of course, difficult cases will need difficult way of treatment.
And terminal cases or borderline cases.
Borderline cases?
मतलब zigzag treatment वहाँ पे भी होगा ना सर कि terminal cases और
Where,
borderline.
where there is deficiency of this, where there is deficiency of this, you have to follow this. Okay, this is zigzag treatment. Otherwise, if you are getting this symptoms of disease, symptom of patient, easy to apply. Minimum. Where there is deficiency of this, where there is deficiency of this, the treatment is zigzag.
Sir, second prescription is very difficult.
Second prescription is very difficult. We will discuss that. Okay, for the beginners, LM potency is very easy to start with. Okay, for the beginners.
LM
It will
पोटेंसी पे
start the
लाइक हाउ टू
difficult-
प्रिस्क्राइब, प्रिस्क्रिप्शन पे
prescribe
कभी
what?
आप लेक्चर लेना सर. LM
इस पे?
पोटेंसीज, LM पोटेंसीज.
Okay, okay, ठीक है. We will discuss this. In last class, we have discussed a little bit of LM potency. Is it not? Have you followed the last class video?
Yes, yes sir. Yes, इसीलिए सर मतलब I wasn't able to grasp the entire thing. So उस पे ज़्यादा explanation होगा तो I'll be better in that.
Okay, I will explain someday. Okay, then we'll stop here. We'll meet
Thank
again
you.
next Sunday. Okay, thank you for giving me your attention.
Thank you sir.